The Local Show, sponsored by Victory in Motion, home of knee repair, not knee replacement, on News Radio 570 WSYR, on 106.9 FM, and live everywhere on the iHeartRadio app. The Local Show features in-depth conversation with business owners, employees, and influential business leaders throughout Central New York, exploring their successes, challenges, and reasons for doing business right here in our growing community. The Local Show is produced locally by Zoe Advertising. Now your hosts, Tom and Steve.
We're back again, back into it, back at it. It's The Local Show with Tom and Steve, and we're broadcasting from...
Mostly Tom.
Mostly me, yes. From the Zoe Advertising Studios, sponsored by Victory in Motion, home of knee repair, not knee replacement. And on YouTube, you can see us, and you can also go to Amazon KDP, that's Kindle Direct Publishing, for those of you keeping up with things, and you can find the book, Repair, Don't Replace.
Yeah, we chatted about it a little bit ago. If they're saying need a knee replacement, maybe not.
Right.
Or a hip replacement for that.
There you go. But our folks at Victory in Motion, Dr. Petropoli used to do a lot of surgeries. Not so many now because they don't have to do it. So
And speaking of aging joints, Melissa
cannabis
Murphy.
I thought you meant cannabis.
Melissa Murphy's with us. She's the founder and CEO of Aging Advocates, CNY Care Management. Melissa, how are you?
I'm doing well. I just started twitching right when you said that, but otherwise I'm doing
Tom does that to people.
I can make you twitch. That's something. Yeah, you've been around aging people for a long time, haven't you?
It seems like decades, centuries.
Yeah, for being such a young lady yourself, but you have lived in that space. Tell people exactly what your company is about, like what your mission is and everything.
Mm-hmm. So have you ever had an aging parent, loved one, friend, maybe fall, end up in the hospital, or have a diagnosis of dementia or something along those lines, and everybody, they look around at each other and they go, oh no.
Yeah, what do we do next?
What do we do?
Yeah. Yeah.
That's what we do.
Okay.
That's great. That's a great setup.
Yeah. So we're the call that you make when you have no idea what to do, where to start. Mm-hmm. So it can be in a crisis. Unfortunately, we would like to meet you before that crisis and maybe try to prevent that crisis, you know. But usually that's when you do have that moment of, oh my goodness, what do we do? And if you've had any experience in the healthcare field, we won't name any specific offices or fields today, but the healthcare system across the board is not so easy to navigate for anyone. I don't care your education level or anything. It's not intuitive and it's not user friendly.
But they know maybe how to, if somebody twisted their ankle, okay, what do we do? But that's beyond they're in that narrow silo.
Right.
If someone falls at home or you're saying, okay, what are the things we can do to help this next time? And if they're going to need rehab, who knows the answers to these questions other than you?
Exactly. And I don't know them, trust me. Yeah. But what I know is all the people who know all the things. So that's what our team has really developed over the years, is a really strong understanding of the services in the community and who are the experts. So if it comes to navigating what does your insurance cover, or legally, how is that going to work with your family and the assets? And then again, medically, of course, which physicians, providers to see. So we are that person or that team.
So how's the team? So the team, you've got people on the team that have specialties, or tell us about the team. How's that work?
Yeah, so I started just myself, and now our care management team, I think, is past 20 full-time aging life care professionals and part-time, ranging from social work to nursing, physical therapy, and a lot of other folks that have just worked in the industry for a long time, and they know the behind the scenes, the ins and the outs. How are we going to actually get things done?
So what if somebody comes to you and says, geez, my mother or father just got diagnosed with dementia, early onset. Can you help?
Yeah, so that is one of our most common areas that we serve. So ranging from what are the most immediate needs to keep that individual safe, to also what types of supports can we put in place to help the caregiver, the family members, because it's not just the person living with dementia that is going to need support. It can be the whole family. Yeah. So we look at it from a holistic perspective, and it's very individual to each family and their needs. And
who is the home builder that actually outfits the house
Bob the Builder.
Oh no, there was somebody that we interviewed, and I think you knew them. They do like the they'll put in the ramps. And
McClurg?
Yeah, that's would it be them.
I was going to say, I think we're talking McClurg.
Yeah,
McClurg is
Maggie
one of
and the team over there.
Yeah, they're one of our preferred providers, I should say, that can help with home modifications.
Right, for elderly people, for senior people, yeah.
Yep, so that's a great example. Cool. So somebody has a need, maybe it's their shower is no longer accessible and they want to stay at home. So that's an area where we could look at what are the best alternatives.
Do people think, okay, I need some help with mom, I'll call the government, I'll call a social...
Don't call the government, I'm sure you'll be on hold a long time.
I mean, like there must be somebody that, right? I mean, they think, well, there's somebody that must know all these things. And if there was, your niche wouldn't exist, right?
You know how many times I hear, I wish I knew about you back then. Or, geez, nobody knows about this.
Right.
So I'm glad to be here because we do exist, but we are kind of a best kept secret right now.
Right.
We are part of a national association. It's called Aging Life Care. Okay. So you can find other providers in different areas, but locally we specialize in Central New York.
You must not have a lot of competition. I think you're the only one who does this whole holistic look at aging.
There's a few other members of that national association that are local, so we coordinate with them as well. But I think we are the largest comprehensive team right now.
How do you do it all? I mean, you are a young lady, and you're married and have a few kids, right? How many kids do you have?
3.
3 kids. That's enough. And so you're a mom and a wife, and you got this going on. How do you balance it all?
So somehow
she doesn't. Let's be honest.
There is no such thing as balance. That is a big lie. You're just like teetering on the edge every day. But I think I was able to use that to my advantage early on, that I knew I couldn't do it all.
Right.
So from the very beginning, I started essentially begging the best people I knew to work with me, and that has just snowballed since. And I think we're a unique team in that we are mostly women from top to bottom locally. So it's like, your kid's sick, what can we do to help you? It's, you're having a bad day, you need to cry. Like, we are so unique in that.
So it's like an estrogen fest.
But if you're not in perimenopause or menopause, I mean, we've got the whole.
But you were smart enough to lead leaders recruit people that know or are farther ahead. Micromanagers have to control everything. It just sounds like a very collaborative, holistic, fairly organic. Right. I'll help you, you help me. Because and if I were to say, at the bottom of it is you all want to help people.
Exactly. I was going to say it actually is in complete alignment with our mission, and we see the similarities between caregiving and our work. So we know nurturing. You have to have a village. You can't do it alone.
Yeah, real quick, can people get ahead of it, or do they have to wait?
Oh my gosh, please get ahead of it.
So how do you get ahead of it?
It's like putting on moisturizer after you already have dry skin.
I don't know anything about moisturizer, but how do you get ahead of it?
Okay, I mean, we can't control everything. There's a medical diagnosis, a crisis. But everything from having those difficult conversations with your family so that if something does arise, it doesn't need to be 10 times worse because nobody knows. There's no documents in place. People are fighting about control, money.
So you help people make a plan? Is this what you're suggesting?
Yeah.
Is the first consultation free, or do people have to come up with money right away?
No, we do a free 15-minute phone call for anyone. And then you can be part of our network where we can send you more information about new resources and other free services in the community. Okay. But no matter what your immediate or long-term goal is or your finances, we're going to make sure you walk away from that phone call with something useful.
So Melissa Murphy, Aging Advocates. If it's about older folks in transitioning and trying to figure things out, here's a lady you need to speak with. 469-1000, is that a good number?
Yes, it's a great number. We are always hiring, too, for anyone looking for a part-time caregiving role. 469-1000, Aging Advocates, CNY.com. Thanks for joining us.